In 2011, Family Healthcare Network used a local food nutrition education grant to take on the challenge of educating recipients of SNAP-Ed support on the importance of making healthy food choices and engaging in a physically active lifestyle.
So basically the project consisted of us bringing nutrition education classes to the community. We started in Goshen. What we did was we brought 3 session classes that went over the My Plate program, that went over the Rethink Your Drink program, and also the Harvest of the Month. So the community got an all-around view as to how to learn about portioning, how to learning about balancing calories, how to learn about including the 5 food groups into every meal. And then with that, we also brought in physical activity. So they got to get exercise, and all of this was free of charge to the community.
4 economically challenged rural communities were chosen for the program. These largely Hispanic agricultural areas, ironically, often lack access to healthy food options. The result? A high incidence of obesity and the related issues of diabetes, hypertension, and cardiovascular disease.
Growing up in Goshen, we grew up on filler foods. We were told, beans, rice, and tortillas, and you're fed, and your family's fed. But that's not necessarily always the healthiest choice.
In order to gain trust, the decision was made to hire and train women of influence from each community to present the programs about healthy food choices and exercise.
It's intimidating for an organization to come in and say, we're going to teach you nutrition, we're going to teach you how to get healthier. But when you go at it as a community engagement and you create a relationship with that community, it's not an organization anymore. It's, those are the promotoras, those are our friends. That's Josette, she's at all of the local events. And so once you're able to establish that relationship on a one-on-one basis with your community, that's when we found success. We looked for women who wanted to step up and really become the leaders of this program, who wanted to be the teachers of this program. We did start off with 4 promotoras of all different ages and different levels of education. We found it important to have the college student. We found it important to have the mother who's worked in the farms, who's worked in the packing houses. We found it important to have, the grandmother figure. The classes were 3 sessions long. It was one day per week for 3 weeks. And so the first class that they would come to, they would learn about My Plate. So we bring in the My Plate, we talk about the 5 food groups, portion sizing, what's healthier choices. I really wanted to encourage the women that they can make healthier changes without changing their identity, without leaving their culture behind.
Family Healthcare Network also partnered with other organizations in order to meet their goals.
We work very closely with the Unified School District, Visalia Unified School District, and with Goshen Elementary, with Traver Elementary. Visión y Compromiso, a organization out of Los Angeles, actually helped us put our promotoras and our staff through trainings to get them trained in bailoterapia, which is dance therapy. It's a form of cardio exercise through dance. So there were many partners that were involved in helping us prepare and to really engage the community and get people involved. Self-Help was a huge partner with us. They provided the community centers free of cost for us. It allowed us to have a safe environment for the women to feel comfortable to come to every week and meet there and to exercise. Some of these areas aren't the safest areas in the valley, and so to feel comfortable enough to be able to come to a class during the evening is a big thing, and that's what Self-Help provided.
Self-Help Enterprises is more than just housing. It's about building community. It's really community driven. We say mi casa, su casa. So it's their community rooms. They can run their program from there. They're fashioned. They have all the amenities.
One important lesson learned was that each community had its own distinct needs. So the program had to be tailored to each location to ensure success.
In the beginning, it was a challenge to get the community engaged, but we found that we had to cater to the community. For instance, in Goshen, we found that the women were more available in the morning, so they were able to do morning classes and they were able to do earlier classes in the evening. And then when we moved into Dinuba, we found that the family dynamic was different. Moms and dads were both working throughout the day, so they needed an evening class, and that's what we did. We catered this program to the community.
And the results were impressive. In the second year, 484 people signed up for the program, and over 97% participated in all of the classes. In the third year, 503 people were recruited and 100% participated in all of the classes.
Our work really does work, and it does make an impact. And so through the evaluation, it's proof that we're making a difference. It's not just somebody saying, yes, I enjoyed the class, and yes, I eat more fruits and vegetables. It's hard facts. I'm proud of the growth that the promotoras have gone through and that they've done in the last 3 years. They've really become leaders of this community. They've grown both personally and professionally. They are that go-to person now within the community, and I'm proud to be a part of that.
Bueno, yo me siento muy contenta, muy feliz de poder llevar este entrenamiento a mi comunidad, porque aparte de que hace mucha falta porque hay mucha obesidad en mi comunidad, me siento muy contenta de yo poder proveer estos servicios en mi comunidad.
Les decimos nuestras experiencias y cómo estuvimos antes y cómo estamos hoy, que es lo importante, que ellas miren, que digan, oh sí, aquí sí hay un cambio y que podemos traer las personas. Es como las traemos, dando nuestro ejemplo.
Empecé a hacer cambios, cómo comer nutritivamente, cómo hacer cambios para bajar de peso, especialmente para mí que estaba a punto de ser diabética, y gracias a este programa y empezar a hacer ejercicio cambió drásticamente personalmente mi vida y con mi familia.
Fue un impacto muy grande porque se siente muy bonito que cuando terminaste un programa en una comunidad, luego vuelves a ir y te saludan con un abrazo, con un beso, y te dicen gracias por haber implementado este programa aquí porque hubo muchos cambios en mi familia. Eso para mí se siente muy bonito, me siento orgullosa de haber participado en este programa de Campeonas del Cambio, o sea, el programa de Mi Plato. Es muy bonito todo este programa que se ha implementado.
And even though the grant has ended, the program lives today due to the foresight of Family Healthcare Network.
We definitely wanted to make sure that this didn't just stop once we stopped. We wanted the community to take it on as their own project. So that's what happened in each community. Women stepped up. They said, we want to continue this, and they have. Goshen has a club, the Goshen Women's Association. They meet 5 days out of the week for an hour, and they do exercise. They've even taken their work into the elementary schools, and they're working with the kids now. So they've really taken a step further than what we had even imagined.
Claro que sí, pues mira, se ha impactado de gran manera en todas las compañeras porque todas de una forma o de otra han estado bajando de peso, su salud ha mejorado increíblemente. Muchas se quejaban de dolor de rodillas y ahora están felices porque ya no, están menos estrés. Tenemos una señora que estaba en depresión y le encanta ir al club porque ahí se siente muy bien, se siente querida, y la convivencia, eso es lo que las motiva a seguir adelante, y que todas estamos perdiendo de peso, y pues eso es una motivación muy grande y nos motiva una a la otra, y seguimos invitando más. Les damos el testimonio de cada una de nosotras y nos miran, dicen, no, yo te veo diferente, yo también quiero hacer lo mismo, yo quiero ir. Le digo, pues ok, son bienvenidas.
Well, based on our experience, we've found that in order to really set up a successful program, it's important to find community leaders because they're the ones that can connect with the community on a personal level. Definitely set up community engagement, creating a relationship with them as opposed to just coming in as an organization, getting to know the community and what their wants and needs are, and also to remain a partner with them, remain a partner with that community, and make it known that this isn't just a project that we're going to do until we're done and then leave, because that's not what our organization has done. We've kept into close contact with all of the communities that we've worked with, and to this day we remain close friends with them.
If we're serious about having a healthy community, healthy communities, these investments need to continue.